Could I just ask you just stand up briefly? Thank you. When Liz said, could you do this presentation, she didn't tell me there was going to be about 140 in the room. You can sit down now. That's instead of coffee. From a public health perspective, it's good to get the blood circulating, and you'll note that because of today, I'm using digital technology, not paper. First of all, I'd just like to give an apology, really, because these aren't my slides. Most of these aren't my slides. It's somebody else's presentation. Unfortunately, Penny Newman, who is the National Innovation Accelerator Fellow, she's also a clinical director in the East of England, was heavily involved in the development of health coaching in the East of England, along with Andy MacDonald, and you'll see some references to their slides on there. The purpose of today's presentation really is about looking at health coaching, what it is, and also exploring some opportunities of how apps might be useful in doing that. Just want to check who's in the room, really. Who's from the private sector? Hands up. Okay, who's from the NHS? Leave your hands up if you're CCGs. Leave your hands up if you're, well, put your hands up again if you're trusts. If you commissioners, providers, we've got a few, okay. Local government, third sector. Who have I missed? Oh, universities, thank you. I've got that on the list as well. Okay, I just want to say a bit about myself. I'm working in the NHS for about 30 years, last 3 years in local government as part of the public health reforms. I grew up in York. I was a very active person, still very active. My kind of experiences with the NHS were few and far between, except for a number of, let's say, accidents, usually falling out of trees, cutting myself, collecting ladybirds when I was about 8, and then more latterly footballing injuries, usually stitches and broken bones. But other than that, not much. I had tonsillitis when I was 21, I had my tonsils out, and that was very painful. I wouldn't recommend it. And more recently, however, I had a little blemish on my forehead. I went to the GP and he referred me to a dermatologist, and he said it's not cancerous, but it could turn that way if you don't treat it. He gave me a prescription which I was supposed to go to the GP with and sort out. It hasn't happened yet. That was about a year ago. I've got to get it done. Okay, so what I was just trying to get into was how much we take from clinicians, doctors, nurses, etc. What do we do in terms of our own behaviour? Now, just put hands up. Who has got medicines in their cupboard at home that they haven't taken that they should have done? There's a few of you. How many have not completed a course of antibiotics because they kind of felt better after a bit? A few more, yeah. I mean, maybe you're not representative of the whole population. How many of you have left a consultation not quite knowing, not quite being clear about what it was? One or two, well, more than one or two people, probably about 20% there. Okay, so what I wanted to do was just take that on, is that currently there are problems, and don't shoot the messenger. Again, these are not my slides, but there are some issues about a lack of adherence to prescribed medicines. There is a poor uptake of behaviour modification advised by a clinician. An interesting fact, again, don't shoot the messenger, GPs interrupt on average every 12 seconds. Okay, any GPs in the room? Good, I got away with that one. And I think what this does is it develops a dependency culture. It creates a paternalistic culture, and I don't think it's just the health service. I think it's public sector services as well. Is that we're constantly giving services, we're constantly giving advice to our communities, and they become depowered. In terms of care, I've got to be careful with this actually because it's got some kind of animation things that I wasn't aware of. The vast majority of care around long-term conditions is by individuals themselves. Clearly, the higher up the triangle you get, the more important it is for behaviours to be modified so that you don't carry on up that triangle. What is interesting though is this bit, that little dark blue, little I was going to say rectangle, triangle. I've got a degree in maths, believe it or not. There are people managing their conditions even though they've got complex conditions. But it's crucial that we have that behaviour change to prevent people getting to those complex cases. So what is health coaching? Well, health coaching is kind of a combination. It builds on clinical skills from the GP, any clinician, nurse, etc. It involves behaviour change methodologies and also applies a coaching philosophy. Coaching is very much about determining goals, but goals from the patient's, the client's perspective. Okay, and it's about building a relationship. It's not advice and listening. It is building a relationship. And what it does is it's about recognizing that the patient or the client or the citizen is an expert. They're an expert in themselves. They're an expert in where they live, their social networks, their family networks, the assets, the support systems that they have. So they're not problems. They're not coming with problems. We need to shift the perspective to one where the patient has got assets. They've got opportunities. They've got the ability to solve problems. And they're also resourceful. And this also applies to populations, which is where my kind of professional interest lies. So health coaching draws on skills from psychology, from coaching, but applies that and marries that with clinical skills that you see there. Actually, I'll use it. Okay, so first of all, it's a mindset change. It is shifting that mindset to recognise that people have got, they're resourceful, they have assets, they bring something to the table. And this is useful in all interactions. Skills, they're useful in some interactions. Need skills in terms of listening, active listening, and then techniques which can be used for very specific behaviour change conversations. Example is T-Grow. Anybody heard of T-Grow? There'll be some of you in the room that have. It's looking at the topic, what the goals are, what the reality is of an individual, what the options are, and then what next. So it's focused on action. The key ingredients. This is a slide showing the training program. It's highly experiential, fast-paced and challenging. It allows the time. This is one of the crucial bits. It allows time to reflect. It allows time to begin to change that mindset. And this has been well evaluated. Hands up those people who've got children. Right, hands up those people who've seen Madagascar. Don't be ashamed. There's a good proportion of you. This will be lost on you if you haven't seen the film. But basically, the purpose of this slide, and I often have kind of bets with my children to see what slides I can get into a presentation. This is mine. This is King Julian. And basically, it's about the goals are for the patient, not the clinician. Okay, so the goals are for the patient, not the clinician. So they are the ones that are an important part of this. If there's one slide I'd like you to remember, it's this one. Need to understand what motivates people. And it could be completely left field, out of the box thinking. It's what motivates people. If walking your fish gets people active and moving, that's what you go with. This particular programme that was piloted in the east of England over a period of years, over about 5 or 6 years, has been heavily evaluated. It's got very, very good outcomes, and I'll just share with you a few of those in the next slide. But the outcomes are so positive that Sir Bruce Kehoe at the national level has said we need to be rolling these types of programs out. And we're hoping to roll some of this out in the northwest as one of the first regions. But there are lots of different health coaching programs. This is just one of them. What's interesting about this is that the benefits are not just for the patients. They are for the clinicians and also for the organisations themselves. Jonathan mentioned right at the beginning that if you want to get things into the NHS, they have to be evidence-based. This has had a lot of evidence. There's a lot of evidence within the US regarding health coaching. They follow very similar principles, and Penny is trying to develop a national set of standards and guidance for commissioners, providers, etc. in the field to maintain that standard. It can be used in lots of different ways, lots of different areas. It's not just long-term conditions. And as I mentioned before, I spoke to Penny last night. She said, "Oh, can you put the slide back in about the National Innovation Accelerator program? Because I'm working for them." It was already in. So the important thing here is, I think, if we're going to try and change the behaviours of populations, of people, patients, we also need to be able to change the behaviours of clinicians. So any apps that are developed need to really focus on that relationship between the patient and the clinician, so that we can get a change not only in behaviours of those two, but also begin to start eking away at the culture within the NHS, from one which is kind of paternalistic, we know best, to one which is far more engaging. So it's a shift between somebody who fixes things to somebody who can enable things to change. It's about building rapport, listening, developing new skills with some good outcomes. It taps into the internal motivation of patients. Remember walking the fish. So where do apps come in? We've talked about the people side of it. What about the technology side of it? I think where we really need to focus is how we enable those behaviour changes to take place between clinicians and patients. And there are already a number of apps out there. And we were talking this morning, was it 160 apps, was it? Got 160 apps And it's good that we've got somebody to quality assure them, because I did a quick search. There was a paper that's just come out from the States, I don't know whether you've seen it, where they've looked at a whole range of apps, categorised them, and I don't know, surprisingly, unsurprisingly, there are only a few that are effective. Okay, so and what was really interesting, I think it was at one of these network events in Middlewich, was kind of exposed me to this kind of environment. Was that in the private sector we expect to have a 7 out of 10 failure rate for new innovations. And that to me in the NHS is just, you know, is just kind of a different planet. And I think we have to get real within the NHS about what we can achieve. So just to, that's one example of health coach. It's a digital platform for health coaching. It's done by telephone as well, which again has got lots of possibilities. But how can digital technology help? Well, it can help in terms of changing the behaviour of clinicians and patients. These are question marks, because I don't know the answer. I mean, there'll be people in the room who have probably a better idea than I have. But I think there's a real opportunity to explore how this might happen. So what are the next steps? Well, I think we're in a learning environment. This is I get quite excited about these kind of environments, because my life in my real job is kind of dull to the point where, you know, I just want to get out, and I am, fortunately, in about 5 weeks' time. But I think there's a lot of energy. What I really like is a lot of energy. It's in a learning environment. But the 3 words under there, I was reading a book about, I don't know, it was about 10 years ago. And I can't remember the book, I can't remember the reference, so excuse me, I've stolen it. But it was about how the Japanese went from being a country that was completely flattened after the Second World War to, you know, a country that's one of the, you know, got the highest GDPs in the world. And one of the things was that they adopted westernized ideas, industrial processes. They adapted them to their local circumstances, and they became so adept at them and proficient that the westernized countries started borrowing them back. And I think this is something that we need to kind of bear in mind. We need to be borrowing initiatives, developing them and adapting them to our local circumstances, and then becoming so adept that we can, other people are stealing them from us. And I'll leave you with this last slide. There is a saying well, 2 sayings. Every journey starts with a single step. And if you want to go quickly, then go alone. And if you want to go far, then go together. And I'll answer some questions at the panel. Thank you.